We have now laid the foundation for a very, very strong, comprehensive neuroscience center. Thankfully, due to the diligent and hard work of the senior administration here at St. Rita's Medical Center, it's also due to the willingness of everyone to be a part of this, because the vision is the same and we have an understanding that we are here to save people's lives. As a stroke physician, I've been doing this for some time now, and I can tell you I am very humbled and in awe of the human spirit, of how resilient people are when they come in the face of catastrophe. What I do is a bit different than other doctors. I meet people on the worst day of their life or the worst day of their loved one's life. As we all know, stroke is the 5th leading cause of death in the United States, and it's one of those diseases that is very time sensitive. We had a patient recently present to us with symptoms of a stroke. We were able to give him the clot-busting medication through the IV, and I took him straight to angio, and we were able to thankfully take the clot out of his brain and fix the narrowing in his neck in the carotid artery. To be able to look at his wife and his daughter and be able to say we saved his life is something that is very humbling to me. This story could have ended much differently. Time is brain. 5 minutes is enough time for a person to lose the ability to speak or understand. What you want is to go to an institution that can do everything from start to finish. Now, when we talk about Neuroscience Center encompasses a comprehensive stroke center as well as all of the subspecialties of neuroscience. Recognizing the need in the community, the executive leadership at St. Rita's Medical Center, in partnership with the neurointerventional physicians, they had a vision of moving forward. Over the last 10 months, we've focused on the protocols that are necessary and pulling teams together to make one unified big team. So now we have a very wonderful group of providers, including mid-level providers and physicians across multiple different specialties that have come together with one goal, and that is to save people's lives. One of the metrics that we use is something called door-to-needle time. And what that means is from the time it takes for you to reach our doors to the time it takes for us to give you a life-saving medication, how long of a time frame was that? The national standard for door-to-needle time is 60 minutes. Our times are closer to 30 to 35 minutes, which is an amazing thing. 35 minutes. As we expand this program and we add to it, our care can only improve. We've already made dramatic strides in a very short period of time with limited resources, and we want to continue to be able to build and grow on that, and for that we need you. Nowadays in the world we live in, there's a lot of opportunity to do good in the world. We pose a unique opportunity to not only do good in the world, but do good in a field that is going to directly impact this community, our families, and frankly, ourselves. What we're doing is taking this challenge head on, and we cannot do that without your support. To the folks that have already given money, I would like to say, just last week we saved someone's life. If it wasn't for you, we would not be able to do that. And we're doing that on a daily basis. So thank you for your donation, and I'm hopeful that we see you again in the future. We often think about diseases in a very scientific manner, but diseases impact family. Diseases impact those we love. And it's a humbling process for me to be a part of being able to save someone's life. This is what I live for. This is why I chose the field I did.